patients who come for infertility, उनको बच्चा नहीं होता है इतने साल, तो दूसरे जिनको हुआ है वो हमारे पास लेके आते हैं, बोलते हैं सर आप प्लीज़ कुछ करो, इनको कुछ दो तो इनको बच्चा हो जाएगा। तो हम ऐसे मेडिसिन देते एंड दे कंज्यूम, देन दे कम बैक अगेन टू अस सेइंग सर ये आपका है, आपका मेरा नहीं, मेरे वाइफ के सामने मत बोलना। ये प्रेडिक्टिव होम्योपैथी का है, मेरा नहीं है। चलो, सो we are celebrating the 269th birthday of Dr. Samuel Hahnemann. Happy birthday, sir, our master. And I'm not my guru, my mentor, my guide, Prafull sir, my dada, I used to say. So now I'll be showing you some cases which are incurable. Only one case. In fact, he told me just yesterday that I was to talk. Yesterday, and in the list I am the 12th man. No 12th man पानी लेके जाता है, bottle लेके. So I am the 12th man. चलो, ठीक है. So we will discuss one case. I'm sharing it with you. A case of CML, Chronic Myeloid Leukemia. ऐसे बहुत सारे आते केसेस। तो हाउ मेनी टाइप्स ऑफ ल्यूकेमियाज आर देयर? ये उन लोग के लिए, हाँ, एलोपैथ्स के लिए। अपने लिए तो अप्रोच एक ही रहता है। AML है, ALL है, CML है, CLL है, बहुत सारे हैं। फर्स्ट स्लाइड दाखवू नको, डायरेक्ट सेकंड स्लाइड नको। Exactly 1 year back, a lady came to me. In fact, she was my previous, when I used to practice allopathy, she was my patient. Her full family was my patient. सुनाई देता क्या? Full family was my patient, and her brother was a very big builder, a very known builder, and she had come to me. She had a lot of weakness, appetite loss. They had done all the investigations. And second slide, Tanmay. All the investigations were done. She had severe breathlessness, appetite decreased, joint pains, dryness of mouth, can't swallow solid food due to esophageal narrowing. And previously in 2017, she had esophageal web in 2017. And then bilateral frontal maxillary sinuses. Now this lady, in fact, was my previous patient. In fact, she used to take allopathy. मैं injection मारता था तो वो लेके जाती थी. And somebody told her that, sir, अभी कैंसर ट्रीट करते हैं, सो आप जाके हम ट्राई करेंगे। उसके भाई के लड़के का फ़ोन आया, मेरे को बोलता है, सर आप मेरी माय आंट इज़ देयर एंड दे हैव डायग्नोस्ड हर विद CML, तो आप कुछ कर सकते क्या? बोले करेंगे। ये होम्योपैथी से ट्रीट होगा क्या? बोला आप भेजो, आई विल ट्राई माई बेस्ट, बाकी तो सब ऊपर वाले के हाथ में। आई ऑलवेज टेल माई assistants, so सब ऊपर वाले के हाथ में। Then she came to me. Next, her thermals were chilly, she was thirsty, perspiration was profuse, she had craving for spicy food, urine stools were normal, sleep was good. Dreams were normal, but she used to get some dreams of, in fact, some Satan at night, some Satan used to come, and he used to, very big, like in black clothes, and he used to try to take her away. That dreams used to get, that we have not. Okay, next. Huh? No, no. History. Patient, there were 10 siblings, and she lost her father at the age of 3. Her mother raised her with great difficulty. Her uncle, who was very cunning, he took over their property, and once they were very much prosperous, they became, from flat they came to chopdi mein rehne aage in Gautan. So she got married at the age of 20. Her husband was an abusive and never used to earn. He was a good for nothing. He used to beat her for money. He used to do character assassination. उसको suspicion था क्या ये ऐसे करती है वैसे करती है बाहर जाती है ये सब. After her mother's death, he started torturing her more because mother used to provide her financially also. So उसके बाद में and used to humiliate her and throw her out of the house, saying आप जाओ आपके भाई के पास. भाई was quite well off. He was a builder. आपके भाई कुछ करते नहीं है तेरे को. They are not helping her, with financially nothing. Next. Her all siblings were doing well-to-do and rich, but they did not help her and never cared for her. And always they used to be on loggerheads, all the siblings. Her son used to accuse her of spoiling his childhood because since very small she started earning and giving him early responsibility. Because of this, she was fed up of all this problem and she attempted suicide also once. She was angry with her husband, disappointed with her brother. Brother never used to help her, nothing. She was surrounded by all this obstacle. So again. Mental generals where she was obstinate, headstrong. She was very loquacious, fearful, impatient and fearful. She was average in studies. She could not stay alone at night. So a lot of fear at night. Haughty, angry and anxious, and she had fear of death, especially when she was alone. And sensitive to criticism, there was fear of drowning, but memory was very sharp. Next. So now, what is CML? CML में क्या होता है? ल्यूकोसाइटोसिस हो जाता है, बराबर? अभी ल्यूकोसाइटोसिस में अभी these are pluripotential stem cells under the influence of cytokines, commitase, ये सब ल्यूकोप्रोटीन के white WBCs, myeloblasts, neutrophils, eosinophils, basophils, monoblast, monocytes, thrombopoietin, megakaryoblast, megakaryocyte, and platelets. These are how platelets and WBCs are formed. अभी तो first ये देखो ना, तो WBCs का count. Now, where was the problem in our analysis? WBC was 55,950 and platelet count was 4,99,000. Hemoglobin was okay. And spear examination showed WBC morphology, leukocytosis with basophilia. So basophils had gone up. So now this is how nowadays we go in for, as sir had taught us, to take the pathophysiology and the conflict relating to that. So next slide. Khali. Still. So different types of WBCs have shown. Neutrophils, first to respond to bacteria or virus. Eosinophilia, known for a role in allergy symptoms. So now what we do is, what type of, which basophils or eosinophils have gone up, or neutrophils have gone up, lymphocytes have gone up. This we see in mostly in leukemias. And what are the functions of this? Or ye functions, why they have gone up? This is how we enter. Next. So basophils were high. Next. So basophils are a type of WBCs that work closely with your immune system to defend your body from allergens, pathogens, and parasites. Basophil release enzyme to improve blood flow and prevent blood clots. So, ये main defense के लिए है, you know. So, what was the delusion of the body at that time? What was the delusion? What delusions can you injury? Injured is being, bolo? Or injury will receive, or injured by surroundings. बहुत है, बहुत सारे रेपेटरी में. मैंने इसमें डाला नहीं क्योंकि इसने मेरे को शॉर्ट टाइम दिया था. Injured is being injured by surrounding, huh? Or delusion. What was her delusion that time? From everywhere she was attacked, from everywhere. Or she was surrounded by, yes. So we took that surrounded by enemies. Delusion surrounded by enemies, rubric. अभी इसमें कौन से रेमेडीज आते हैं? Anacardium, carbon sulf, drosera, Crotalus horridus, Lapmar, and Merck. अभी इसमें से which we will एक एक करके हम लोग निकालेंगे. Anacardium थी? Not at all. She was sense of right and wrong was there, and she was not at all. Carbon sulf she was not there. Drosera नहीं. So Crotalus horridus, Lapmar, and Merck. These two. She was very, very loquacious, a typical, and I have seen many leukemias respond to ophidias. So we gave her Crotalus horridus, 200. 4 pills. I have in this type of cases where there is prolonged pathophysiology change is there. I repeat every day 4 pills. Next. So follow-up 1/5/2023. Hemoglobin was 11.7. WBCs had increased 63,540. Platelets 5,44,000. Her breathlessness was SQ, or swallowing was SQ. Joint pains were better. Only the joint pains were better. Is it a good sign or a bad sign? Are we going towards cure? Dryness of the mouth was SQ. So we again went through the full history, and we found out that she had that typical dreams of somebody, some person wearing black and coming to take her away. और वो Crotalus cascabelis में है. And there was lot of fear. Fear when she was alone, fear of death. कि मैं अकेले बैठी हुई तो मैं मर जाऊंगी. That is why she used to keep her daughter with her. Next. So we gave her Crotalus cascabelis 204 pills daily. Next. Hemoglobin 11.3. WBC count 16,790. Platelet 5,55,000. बोला था ना platelet जाते ऊपर. Breathlessness better, joint pains better, swallowing better. Joint pains were there. Now these joint pains were there. Dryness of mouth was better, weakness, appetite had increased. She has started eating, the sora had come. Next. Again, this was repeated. Next. 23/8/2023. Hemoglobin 11.8, WBC 16,420, platelet 6,72,000. Body ache was there. Difficulty in swallowing was better. Weakness was better. Breathlessness was better. Next. Again, Crotalus cascabelis 4 pills daily was continued. Next. follow-up on 20-10-23. Hemoglobin 13. WBC count 8,020. Platelets within range 3,75,000. Body weight was better. Sinusitis आ गया. Inflammation, trembling was better. Difficulty in swallowing was better. Again the same medicine was given. Again. Now again 12.5, same. 2020 paratali. So now wait a minute. So after that what happened? Again she had severe choking sensation. She could not eat and severe burning in the esophagus. So I had told you that in 2017 she had that web and they did an endoscopy and that web had come, but it was not that severe and there was lot of gastritis. Now here the catch is, now she was stable. Her WBC had come down to normal and she was stable. Now I gave her a GCS, which was lachesis, and we gave her a GCS. That web disappeared, swallowing was better, gastritis gaya, and the doctors were said that we will dilate it. बोला आपको वापस जाना है, return, dilate करो, सब कुछ करो, आप वापस dilate आप 55,000, सच्ची 55,000 नहीं 65,000 पे गया था. So next, lachesis was given 11.9. This is the recent 29/3/2024. 11.9, 7,180. Platelet 3,20,000. Weakness better, sinusitis better, breathlessness better, swallowing better, everything better. Now you show the. Now see. This is next, Tanmay. Now you see hemoglobin 12.5, 27. WBC was 27,500, has come down to 5,570. This is the graph. Platelets also ऊपर नीचे 4,090. ये है 27,590. ये तो बाद में है mid. It has come down to 5,830. And she did not go in for chemo. She was advised bone marrow, and she was told that खाली 3 महीना है आपके पास हाथ में. तो इन लोग कितना घबराते हैं, देखो घबा इसके ऊपर ही उन लोग कमाते हैं. They frighten the patient. क्या अरे अभी तो हो गया, आपका टाइम आ गया. देखो टेस्टिमनी लोगों में. This is the lady.
मेरा नाम फरजाना अब्बानी है. मैं मतलब पहला मैं जैसा रमजान में मेरे को 63.2 CBC थे. अभी कम है मेरे को, बहुत फर्क है. 63,500 थे और अभी मेरे को बहुत फर्क है इससे.
क्या बोला था डॉक्टर्स ने?
डॉक्टर ने तो 3 महीने का टाइम दे दिए थे, लेकिन अभी बहुत डॉक्टर की दवा से मेरे को बहुत फर्क है.
ब्लड
टेस्ट वो सब टेस्ट किए, सब अभी सब नॉर्मल आए हैं.
पहले कैसे क्या हो रहा था उस वक्त?
पहले तो अंदर में अंदर कपकपाती आती थी और पैर इतनी कपकपाती थी, भूख नहीं लगती थी, एकदम आलू कैसी पड़ी रहती थी दिन भर. अभी मेरे को बहुत फर्क है.
और डॉक्टर्स ने क्या बोला था खून ये करने के लिए, क्या बोला था?
डॉक्टर ने कि ब्लड मतलब वो है, अपने को अभी आगे वैसा करना पड़ेगा, डिसीजन दूसरा कुछ लेना पड़ेगा, लेकिन
दूसरे का खून
मतलब ये दवा से मेरे को बहुत जल्दी बहुत फर्क.
बोन मैरो ट्रांसप्लांट
1 साल में मतलब मैं खड़ी हो गई.
कीमो लिया था?
एक साल भी नहीं थी डॉक्टर की, ना बोन वीरो कराई, ना कीमो ली, कुछ नहीं कराई.
अभी अच्छा लग रहा है?
अच्छा फर्क है ना डॉक्टर.
This is the limitless scope of homeopathy. This is the limited. And sir बोलते थे क्या, if the medicine is right, सब कुछ ठीक हो जाएगा. She got her, उनका ओरिजिनल जो घर है वो वापस मिला. her brother gave her that ये तू अभी इधर रह करके, and her husband started working. That was amazing. Thank you, thanks a lot.